Welcome to our video on radiation damage, effects, and syndromes. Today we'll explore the various ways radiation can impact the human body. Radiation damage is categorized into two main types, deterministic and stochastic effects. Understanding these classifications is crucial for comprehending radiation's impact. Deterministic effects are those that have a threshold dose, meaning a certain amount of radiation is needed before the effect appears. Once this threshold is crossed, the severity of the effect increases with the dose, such as skin burns or organ damage. Stochastic effects, on the other hand, have no known threshold. The probability of these effects occurring increases with the radiation dose, but the severity of the effect itself is independent of the dose. Cancer is a prime example of a stochastic effect. When the body is exposed to a very high dose of radiation over a short period, it can lead to acute radiation syndromes. There are three main types. First, the hematologic syndrome, which involves damage to the bone marrow, leading to a significant decrease in the production of blood cells. This can severely compromise the immune system and oxygen transport. Next, the gastrointestinal syndrome results from damage to the lining of the digestive tract, causing severe nausea, vomiting, and diarrhea. This can lead to dehydration and electrolyte imbalances, becoming life-threatening. Finally, the cerebrovascular syndrome involves severe damage to the central nervous system. This syndrome manifests with neurological symptoms like confusion, seizures, and ultimately, rapid death. Acute radiation lethality is a complex process that unfolds in two distinct stages after a significant radiation exposure. The first is the prodromal stage, which occurs within hours to days after exposure. Symptoms include nausea, vomiting, diarrhea, and fatigue, indicating the body's immediate reaction to the radiation. Following the prodromal stage is the latent period, where the individual may appear to recover and symptoms subside. However, internal damage continues, leading to the later onset of severe symptoms or death. Beyond systemic syndromes, high-dose irradiation can cause significant local tissue damage, often referred to as somatic effects. High doses of radiation can severely affect the skin, causing erythema or redness, desquamation, which is skin peeling, and epilation, which is hair loss. The severity depends on the dose and area of exposure. Other tissues vulnerable to high-dose irradiation include reproductive organs, which can lead to infertility, the eyes, risking cataract formation, and blood vessels, causing circulatory problems and impaired tissue healing. Even long after initial exposure, radiation injury can manifest as late effects, which appear months or years later. Carcinogenesis, or the development of cancer, is a well-known late effect. Radiation can damage DNA, leading to mutations that increase the risk of various types of cancer, often appearing decades after exposure. Cataract formation, the clouding of the eye lens, is another significant late effect. It can severely impair vision and often requires surgical intervention. Radiation exposure can also lead to a general shortening of the lifespan due to a combination of various health issues caused by the damage to cells and tissues over time. In summary, radiation damage can lead to a range of effects, from acute syndromes with immediate consequences to late effects that emerge over many years. Understanding these mechanisms is vital for radiation protection and medical treatment.